right, today we're diving into something truly fascinating, but also kind of terrifying. We're talking about a rare condition where the body's own defense system, its most trusted guardian, suddenly becomes its own worst enemy. I mean, it's a wild thought, right? Our immune system is supposed to be our ultimate guardian. But in a condition called Guillain-Barré syndrome, it goes rogue and launches this all out assault on our own nerves. So, how on earth does that happen? Well, let's start at the very beginning. So, the story of Guillain-Barré syndrome, or GBS as we'll call it, it doesn't start with a big dramatic bang. Nope. It's more like a whisper, this really unsettling feeling that something is just profoundly wrong. Just try to imagine this. One day, you're totally fine. The next, you get this weird tingling, this pins and needles feeling in your feet. And then, your legs start to feel incredibly heavy. And we're not just talking about being tired. This is a real weakness, and it starts to spread. It's so alarming because it literally comes out of nowhere. And this classic pattern is exactly what doctors are looking for. First, the weakness is ascending. That means it literally climbs up your body, from your feet to your legs, then up to your torso and arms. It's also symmetrical, which just means it hits both sides of your body equally. But here's the really scary part, the speed. Someone can go from feeling just a little off to being completely unable to walk in just a few days. It's incredibly rapid. Okay, so what in the world is causing this sudden, frightening paralysis? Well, the answer is it's a profound betrayal by our own immune system. So here's the official definition. Let's break this down because it sounds a little academic. Immune-mediated just means your immune system is the bad guy here. And peripheral nerves, those are basically all the nerves outside your brain and spinal cord. Think of them as the wiring that controls your muscles and carries sensations. So with GBS, the immune system is basically going around and cutting the communication lines between the brain and the rest of the body. And the main reason this happens is because of a concept called molecular mimicry. And this is absolutely fascinating. Really, you can just think of it as a biological case of mistaken identity. It's like a friendly fire incident, but on a massive body-wide scale. Okay, so this lays out exactly how that big mistake happens. So check this out. It usually starts with something really common, like a stomach bug or a bad cold. Your body does its job, right? It makes antibodies to fight off the infection. But, and this is the whole key, parts of that invading germ look almost identical to parts of your own nerve cells. So the antibodies, which are now on high alert, they just can't tell the difference. They see your perfectly healthy nerves, mistake them for the enemy, and launch an attack. They start stripping away the protective coating, and that's what causes the damage and the weakness. So you can see why this is a race against time. With symptoms that can get so bad so quickly, diagnosing GBS takes some serious clinical detective work. And it's such a critical question, right? When a patient shows up with this kind of rapidly progressing, symmetrical weakness, doctors have to be detectives. They've got to piece together all the evidence really carefully to make sure it's not something else, like a stroke or a spinal cord injury. And these three clues are pretty much the gold standard for figuring it out. First up, the clinical exam. The doctor taps your knee with that little hammer, and nothing. Little to no reflex. That is a huge red flag. Second, they'll do a lumbar puncture or a spinal tap, and the fluid they collect has this very specific signature. You see a ton of protein that's been shed from the damaged nerves, but, and this is key, a normal number of white blood cells. It shows damage without an active infection in the nervous system. And finally, nerve conduction studies. You can think of this like an electrician checking the speed of your body's wiring. In GBS, those electrical signals are moving way slower than they should be. Okay, so once the diagnosis is confirmed, the goal is twofold. Stop the immune system's attack dead in its tracks and support the body while it's in crisis. So how do they do that? Well, there are two main weapons in the arsenal here, and both are really effective. First, you've got plasma exchange, or PLEX. The best way to think about this is like an oil change for your blood. A machine literally filters out the patient's plasma and all those rogue antibodies and replaces it. The other option is intravenous immunoglobulin, or IVIG. This takes a totally different approach. It basically floods the patient's system with a ton of donated healthy antibodies. The idea is that these good antibodies overwhelm and neutralize the harmful ones that are causing all the damage. But it's so important to understand that treatment is way more than just stopping the attack. The supportive care is quite literally life-saving. You have to remember, this paralysis can affect the muscles you use to breathe. So up to 30% of patients, nearly a third, will need a ventilator to help them breathe.
So you've got constant monitoring of vitals, managing what can be really severe nerve pain, and starting physical therapy as early as possible. All of this is absolutely essential for getting the best possible outcome.
So, after going through such a terrifying ordeal, what does the road to recovery actually look like?
And this is where the story gets really remarkable. I mean, while the acute phase is just harrowing and the rehab can take months, sometimes even years, our bodies have this incredible capacity to heal. Those nerves, they can, and they often do, regrow their protective coatings.
Just look at this number for a second. 85%. Let that sink in. That is such a powerful and hopeful statistic. It means the vast majority of people who go through this devastating paralysis will, with a lot of time and intense therapy, get back on their feet and walk independently again.
So this chart really gives us the full picture, and you can see the outlook is overwhelmingly positive. That huge slice, about 85%, represents people who make a full or at least a very functional recovery. But we also have to be realistic. For some, GBS does leave lasting effects. About 10% are left with a significant permanent disability. And tragically, around 5% of cases are fatal, usually because of complications like pneumonia or heart problems during the acute phase.
And all of this really leaves us with the ultimate question, doesn't it? GBS gives us this profound, almost scary window into the delicate balance of our own immune system. Figuring out why this case of mistaken identity happens in some people after an infection but not others, that's the key. And the more we learn about these strange biological civil wars, the closer we get to one day, hopefully, preventing them from ever starting in the first place.